Welcome to Medical Assistant course. Chapter 2, Vital Signs. Contents on this chapter are: body temperature, variations due to methods of measurement, variations due to outside factors, methods of measurement, measuring devices, concepts of temperature, blood pressure, low blood pressure, types of low blood pressure, risk factors, treatment and drugs, high blood pressure, types of high blood pressure, risk factors, treatment and drugs, blood pressure testing, respiratory rate, heart rate, factors that affect heart rate, abnormal heart rates, heart rate measurement, vital signs. Vital signs are measurements of different physiological statistics, often taken by health professionals, in order to determine basic body functions. Taking vital signs normally means the recording of body temperature, blood pressure, respiration, and pulse. Normal vital signs can change due to different factors such as age, sex, weight, exercise, and even health conditions. For the average healthy adult, normal vital signs are: temperature, 97.8 to 99.1 degrees Fahrenheit. Blood pressure, 128ths of a millimeter/Hg. Respiratory rate, 16 to 20 respirations per minute. Heart rate, pulse, 60 to 100 beats per minute. In order to take and record vital signs, the following equipment is needed: thermometer, to measure temperature; sphygmomanometer, to measure blood pressure; stethoscope, in combination with a sphygmomanometer to measure blood pressure; watch, to measure pulse, body temperature. Body temperature refers to the amount of heat produced and sustained by the body processes. Changes in body temperature are usually indicators of underlying problems such as disease or other abnormal conditions. The metabolism of nutrients generates heat within the body. This heat is lost from the surface through convection, radiation, and evaporation of perspiration. The production and loss of heat are generated and controlled in the hypothalamus and the brainstem. Fever is usually caused by an increase in heat generation, although certain conditions, for example congestive heart failure, can produce small increases of the body temperature through damage of the heat loss function. Unusual low body temperatures can be caused by interference with regulatory centers or problems of the hypothalamus. The average adult temperature is around 98.6 degrees Fahrenheit, taken orally. The temperature taken under the arm, axillary temperature, is usually half a degree Fahrenheit to 1 degree Fahrenheit lower than temperature taken orally, whereas temperatures taken via the anus, rectal temperature, can be half a degree Fahrenheit to 1 degree Fahrenheit higher than an oral temperature. Variations due to methods of measurement. Temperature results may vary depending on the method of measurement that is used. In general, oral, rectal, gut and core temperature are well correlated, and oral temperature being the lowest. Oral temperatures can be affected by smoking, intake of food, drinking and chewing, as well as breathing. If the mouth is open where air can reach into the mouth, temperatures taken under the arm, inside the ear and other skin-based temperatures correspond very poorly with the core body temperature. The temperature measured orally is lower than rectal and core body temperature. Temperatures taken under the arm are lower than oral temperatures. The body uses skin as a mechanism to increase or decrease the core body temperature, which makes temperatures taken by skin-based methods more variable than others. Variations due to outside factors. Temperature can also be affected by various outside factors. With the intake of food or drinks that are calorie-rich, the temperature will increase. Diets that are calorie-restricted will reduce the temperature. The consumption of alcohol will show a small decrease in temperatures during the day but increase temperatures during the night. Physical activity can also increase body temperatures. In adults, a high increase usually requires difficult exercise or physical workout that is sustained over time. Children, however, can reach higher temperatures with only minimum physical activities, Like playing, the emotional or mental state of mind can also interfere with temperature. A person with a higher level of excitement may also have an increased temperature. A person's sleep patterns can also affect body temperatures. In general, temperatures drop at night and throughout the night. Higher temperatures at night will occur if short-term sleep deprivation is present, and lower temperatures will occur if long-term sleep deprivation is present. Having poor sleep quality, or even insomnia, can lead to a decrease in temperature. Also affecting body temperature are shift work, changes to it, waking up at unusual times, or even jet lag. Methods of measurement. Sites used for temperature measurement include oral temperature, in the mouth; rectal temperature, in the anus; tympanic temperature, in the ear; axillary temperature, under the arm; vaginal temperature, in the vagina; on the skin of the forehead; in the gut by swallowing a small thermometer. Over the temporal artery, temperature readings will vary depending on which body part is measured, but typical temperatures, daytime, for healthy adults are rectal, vaginal, and tympanic temperature about 99.7 degrees Fahrenheit. Oral temperature about 98.2. Axillary temperature about 97.6 degrees Fahrenheit. Measuring devices. The device used to measure temperature is called a thermometer. A thermometer consists of two important parts: the temperature sensor, for example bulb-on mercury thermometers, where a slight physical change in temperature occurs, as well as a way of converting this physical change into a number, for example scale on mercury thermometers. There are different types of thermometers. Liquid-filled. Traditional thermometers consist of a glass tube with a bulb at the end that contains liquid which expands with temperature in an even manner. The glass tube is narrow and has markings on it called calibration markings. The liquid is usually mercury; however, in alcohol thermometers, colored alcohol is used. In order to use a thermometer, the bulb must be placed into the area where the temperature will be measured and left there for about 3 minutes, for it to reach thermal equilibrium. Mercury in glass thermometers are considered the most accurate liquid-filled thermometers. Mercury, however, is a toxic metal. In order to minimize the amount of mercury in a thermometer, the tube must be very narrow. As the temperature of the tube is not controlled, the mercury in it must be much less than in the bulb to minimize the effect of temperature of the tube, which makes for a more difficult reading since the mercury column is hardly visible. With colored liquid-filled thermometers, visibility does not cause that much of a problem. Since glass thermometers are designed that the temperature will not decrease once removed from a patient, the reading will remain without change until the bulb comes in contact with something that has a higher temperature or with the thermometer being shaken down. Shaken down is the method of pushing the mercury back into the bulb from the stem. Once the thermometer reads 95 degrees Fahrenheit, it was shaken down enough and is available for use again. Electronic thermometers, also called digital thermometers, display numeric values. Most of them show readings with good accuracy of about 0.2 degrees Fahrenheit, although it should not be taken as an accuracy guarantee, and specified accuracy should be checked with documenting and maintaining of periodical recalibration. Contact. These electronic thermometers measure temperatures by contact, where the sensor is placed in the area where the temperatures are measured and left there until it reaches equilibrium. These thermometers usually reach equilibrium faster than mercury thermometers, and in general, these contact thermometers beep once equilibrium is reached. Remote. There are other types of electronic thermometers that work through remote sensing: a sensor, infrared, that will respond to the radiation spectrum that is emitted from the location where the temperature is measured. These thermometers do not come in direct contact with the location to be measured but could touch parts of the body, for example measuring the temperature of the eardrum that is inserted into the ear canal. To avoid the risk of cross-infection of patients, these thermometers have disposable covers. Basal thermometer. These are special glass basal thermometers that are very different from usual glass fever thermometers. Digital thermometers could be used for measuring basal body temperature as they have a sufficient resolution, but their specifications should be regarded and checked for accuracy and calibrated at certain intervals. Concepts of temperature. Fever. A common medical sign characterized by an increase of temperature above the normal level due to an increase in the body temperature regulatory set point is a fever. Causes for most fevers are infectious diseases, although other causes that can lead to fever include medication, immunizations, heat exhaustion, and even tumors. The treatment of fever depends on what is causing the fever. Over-the-counter medications such as ibuprofen or acetaminophen can be used. Adults can also take aspirin to medicate fevers. Core body temperature. The core body temperature is the operating temperature of an organism in deep structures of the body, like the liver. Normally the core temperature is maintained with a narrow range for essential enzymatic reactions to occur. A significant core body temperature increase, hyperthermia, or a significant decrease in core body temperature, hypothermia, that is persistent for more than just a short amount of time is incompatible with human life. Basal body temperature. The lowest temperature attained by the body, usually during sleep, is the basal body temperature. Generally, it is measured right after waking up and before any physical activity takes place, although the temperature measured then may be higher than the actual basal body temperature. Hypothermia. The condition in which the core temperature drops below the required temperature level, defined as 95 degrees Fahrenheit, for normal metabolism and body functions is hypothermia. Body temperature is usually maintained at a constant level through a biologic thermoregulation. If exposed to cold, and the internal mechanisms become unable to replenish the heat that is lost, a drop in body temperature will occur. The treatment for hypothermia varies from non-invasive, passive external warming to external rewarming to active core rewarming. In more severe cases, resuscitation begins with accompanying removal from the cold environment and simultaneous management of the airway, breathing, and circulation. Hyperthermia. The condition in which the core temperature increases due to failed thermoregulation is hyperthermia. It occurs when the body produces or absorbs more heat than it can consume. When the increased body temperature is high enough, it is considered a medical emergency and requires immediate treatment to prevent disability or death. Most common causes conflicting reactions to drugs or heat stroke, an acute condition of hyperthermia caused by extended exposure to excessive heat. The treatment for hyperthermia depends much on the underlying cause that needs to be corrected. Hyperthermia caused by exertion on hot days could be treated with self-care measures like resting in cooler places or drinking more water. Hyperthermia caused from drug exposure can be treated by ending the use of the causing drug or by drugs to counteract them. Fever-reducing drugs such as paracetamol and aspirin have no value in treating hyperthermia. When the body temperature reaches about 104 degrees Fahrenheit, or if the affected person is unconscious or showing signs of confusion, it is considered a medical emergency that requires treatment in a proper medical facility. Blood pressure. Blood pressure or BP is the pressure exerted by circulating blood upon the walls of blood vessels. Without further specification, blood pressure usually refers to the arterial pressure of the systemic circulation. During each heartbeat, blood pressure varies between a systolic maximum and a diastolic minimum pressure. Blood pressure, due to pumping by the heart and resistance to flow in blood vessels, decreases as the circulating blood moves away from the heart through arteries. Blood pressure drops most rapidly along the small arteries and arterioles and continually decreases as blood moves through the capillaries and back through the veins to the heart. Valves in veins, gravity, and pumping from contracting of skeletal muscles, can also influence blood pressure at different places in the body. Blood pressure measurement without specification usually refers to the systemic arterial pressure that is measured on the inside of an elbow, at the brachial artery, at a person's upper arm. The measurement is usually expressed as the systolic pressure over the diastolic pressure, for example, 120/80ths of a millimeter of mercury. Definition: systolic and diastolic. Systolic. This is the blood pressure at the time when the heart is contracting, specifically the maximum arterial pressure during contraction of the left ventricle of the heart. This time, at which ventricular contraction takes place, is called systole. A systolic sound is a heart sound that is heard during systole, the time the heart contracts, between the normal first and second heart sound. Diastolic. This is the blood pressure at the time when the heart is in a relaxation and dilatation, expansion, period, specifically the minimum arterial pressure during relaxation and dilatation of the ventricles of the heart when the ventricles fill with blood. A diastolic sound is a heart sound that is heard during diastole, the time the heart relaxes. Low blood pressure. The medical term for low blood pressure is called hypotension and is blood pressure low enough that the blood flow to organs is insufficient, and symptoms of low blood pressure can occur. Symptoms or signs of low blood pressure can include dizziness, being lightheaded, or even fainting. Such symptoms mostly occur when the person goes from a sitting or lying position to a standing position and is called orthostatic hypotension. If the blood pressure is low enough to cause an insufficient blood flow to organs, it can result in strokes, heart attacks, and kidney failure, with the most severe form being shocked. To determine the cause of low blood pressure, blood tests, cardiac testing for arrhythmias, or radiologic studies can be taken. The treatment of low blood pressure can be determined by its cause. Causes for low blood pressure. Pregnancy. During pregnancy, a woman's circulatory system expands very fast, which can cause blood pressure to drop rapidly. After giving birth, blood pressure levels usually return to a normal level. Pre-pregnancy. Heart problems. Some heart problems can cause low blood pressure as they might prevent the body from circulating enough blood. These heart conditions include heart valve problems, bradycardia, extremely low heart rate, heart attack, or even heart failure. Dehydration. Dehydration causes the body to lose more water than it is taking in. Mild dehydration may cause dizziness, feeling weak, or even fatigue. Vomiting, severe diarrhea, fever, overuse of diuretics, and/or exhausting physical activity can all lead to dehydration. Loss of blood. High blood loss caused by a major injury or even internal bleeding will reduce the amount of blood in the body, which will lead to a drastic drop in blood pressure. Endocrine problems. Hypothyroidism, underactive thyroid, or hyperthyroidism, overactive thyroid, can cause low blood pressure. Additionally, other conditions, such as adrenal insufficiency, Addison's disease, low blood sugar, hypoglycemia, and, in some cases, diabetes, can trigger the blood pressure to drop. Severe infection. Septicemia can happen when an infection in the body enters the bloodstream. Conditions of septicemia can lead to a life-threatening drop in blood pressure, septic shock, severe allergic reaction. Anaphylaxis is a severe and potentially life-threatening allergic reaction. Triggers of anaphylaxis include foods, certain medications, insect venoms, and latex. This condition can cause itching, hives, breathing problems, a swollen throat, and a drop in blood pressure. Lack of nutrients. Insufficiency of vitamins B12 and folate can cause anemia. Anemia is a condition in which your body doesn't produce enough red blood cells, causing low blood pressure. Causes for blood pressure. Some medications can also cause low blood pressure. These medications include alpha blockers, beta blockers, diuretics, certain antidepressants, tricyclic antidepressants, drugs for Parkinson's disease, sildenafil, Viagra, particularly in combination with the heart medication nitroglycerine. Types of low blood pressure. Low blood pressure is often broken down into different categories, depending on the cause as well as other factors. The following are types of low blood pressure: postural or orthostatic hypotension. A sudden drop in blood pressure when standing up from a sitting or lying position, leading to symptoms of dizziness, feeling lightheaded, blurred vision, and even fainting. It can occur for a variety of reasons, including pregnancy, dehydration, prolonged bed rest, diabetes, heart problems, burns, excessive heat, large varicose veins, and certain types of neurological disorders. Medications that can cause this type of low blood pressure include certain antidepressants, drugs to treat high blood pressure, medications for erectile dysfunction, and/or medications for Parkinson's disease, postprandial hypotension. A sudden drop in blood pressure after reading. Most likely to affect people with high blood pressure or people suffering autonomic nervous system disorders. To help reduce the symptoms, a person could eat smaller portions, low-carbohydrate meals, or lower the dose of blood pressure medications. Neurally mediated hypotension. This form of hypotension mostly affects young people. The cause seems to be a miscommunication between heart and brain and can decrease blood pressure after standing for longer periods, with leading symptoms like nausea, dizziness, and fainting. Drager syndrome. Multiple system atrophy with orthostatic hypotension. This rare disorder causes progressive damage to the autonomic nervous system, which controls involuntary functions such as blood pressure, heart rate, breathing, and digestion. Although this condition can be associated with muscle tremors, slowed movement, problems with coordination and speech, and incontinence, its main characteristic is severe orthostatic hypotension in combination with very high blood pressure when lying down. Risk factors. Hypotension can occur in anyone, though certain types of low blood pressure are more common depending on your age or other factors. Age. Low blood pressure on standing after reading. This type of hypotension mostly occurs in adults older than 65. Medications. Certain medications like high blood pressure medications, alpha blockers, have a greater risk of low blood pressure. Certain diseases. Diabetes, some heart conditions, as well as Parkinson's disease can put a person at greater risk of developing hypotension. Treatment and drugs. Treatment is not required if signs and symptoms are only mild. If low blood pressure causes symptoms, the treatment much depends on the underlying cause, and this primary cause should be addressed rather than treating the low blood pressure itself. If low blood pressure is caused by medications, treatment options would be to change the dose of medication or stop the medication completely. There are several medications that are used alone or together, can be taken to treat orthostatic hypotension, low blood pressure when standing up. As an example, the drug fludrocortisone is commonly used to treat this type of low blood pressure as it helps to boost blood volume and therefore raises blood pressure. The drug midodrine, Orvitin, Proamidin, is often used to raise standing blood pressure levels in people with chronic orthostatic hypotension, as it works by restricting the ability of blood vessels to expand and therefore raises blood pressure. High blood pressure. High blood pressure, hypertension, is a medical condition where the force of blood against artery walls is high enough that it can cause health problems such as heart disease. It typically develops over the course of many years and eventually affects nearly everyone. However, high blood pressure can easily be detected. Leaving high blood pressure uncontrolled increases the risk of severe health problems such as heart attack and even stroke. In most people with high blood pressure, signs or symptoms are not present. Nevertheless, a few people with early-stage high blood pressure can experience headaches, dizziness, or even nosebleeds. These symptoms usually don't occur until hypertension has reached a severe or life-threatening stage. Types of high blood pressure. High blood pressure is classified into two types. Primary, essential, hypertension. There is no identifiable cause of hypertension. This form of high blood pressure usually develops slowly over the course of many years. Secondary hypertension. Hypertension is caused by an underlying condition. This form of high blood pressure usually appears suddenly and causes a higher blood pressure than primary hypertension. Various conditions and medications can lead to secondary hypertension, including kidney problems, adrenal gland tumors, defects in blood vessels born with, congenital medications, birth control pills, cold remedies, decongestants, over-the-counter pain relievers and some prescription drugs. Illegal drugs, cocaine, amphetamines. Risk factors. Age. With age, the risk of high blood pressure increases. It is more common in men through the early middle age. Women tend to develop hypertension after menopause. Race. High blood pressure is common among African Americans, often developing at an earlier age in comparison to Caucasians. Complications, stroke, heart attack, are also more common in African Americans. Family history. High blood pressure tends to run in families. Physically inactive. People that are physically inactive or not active enough tend to have higher heart rates. As the heart rate increases, the heart has to work harder with each contraction and the force on the arteries is stronger. The lack of physical activity also increases the risk of being overweight and obesity. Overweight or obesity. Weight plays an important role in blood pressure. The more a person weighs, the more blood is needed for oxygen supply and nutrients to the tissue. As the amount of blood increases that are being circulated through blood vessels, the pressure on the artery walls increases as well. Using tobacco. Not only does smoking or chewing tobacco immediately raise blood pressure temporarily, but the chemicals in tobacco can damage the lining on artery walls. This can cause arteries to narrow, increasing blood pressure. Secondhand smoke can also increase blood pressure. Alcohol, too much. Drinking too much can damage the heart over time. Consumption of more than 2 or 3 drinks in a sitting may also increase blood pressure temporarily, as it can cause the body to release hormones that raise blood flow and heart rate. Sodium. Too much salt in a diet can cause the body to retain fluid, which increases blood pressure. Potassium. Too little. Potassium helps balance the amount of sodium in cells. If there is not enough potassium in the diet, too much sodium can accumulate in the blood. Stress. High levels of stress can lead to a temporary yet dramatic increase in blood pressure. If a person tries to relax by eating more, drinking alcohol, or using tobacco, the problems with high blood pressure may only increase. Chronic conditions. Certain chronic conditions can also increase the risk of high blood pressure, including high cholesterol, diabetes, kidney disease, and sleep apnea. Pregnancy. Sometimes pregnancy contributes to high blood pressure, even though high blood pressure, hypertension, is more common in adults. Children can be at risk for hypertension too, as it could be caused by kidney or heart problems. However, poor lifestyle habits like unhealthy diets or not enough exercise can also lead to hypertension. Treatment and drugs. The goals for the treatment of high blood pressure depend on the overall health of a person. Changing the personal lifestyle can help toward controlling high blood pressure. If changes in lifestyle aren't efficient enough, medications are available to lower blood pressure. Which medication is needed depends on the stage of high blood pressure and whether there are other medical problems. Medications used to treat high blood pressure include the following. Thiazide diuretics. Diuretics, also called water pills, act on kidneys to help the body eliminate sodium and water and reduce blood volume. Diuretics are often the first, but not the only, choice in high blood pressure medication. Beta blockers reduce the workload on the heart and open blood vessels, which causes the heart to beat slower and with less force. When prescribed alone, beta blockers don't work as well in blacks or in the elderly, but when combined with a thiazide diuretic they show effectiveness. ACE inhibitors. Angiotensin-converting enzyme inhibitors. Help relax blood vessels as they are blocking the formation of a natural chemical that narrows blood vessels, angiotensin II receptor blockers. Help relax blood vessels as they block the action, not the formation, of a natural chemical that narrows blood vessels. Calcium channel blockers. Help relax the muscles of blood vessels. Some can also slow the heart rate. These medications may work better for blacks and older adults than do ACE inhibitors or beta blockers alone. Renin inhibitors. Tecturna slows down the production of renin, an enzyme produced by kidneys that starts a chain of chemical steps that increases blood pressure. Tecturna reduces the ability of renin to begin this process. Alpha blockers reduce nerve impulses to blood vessels and therefore reducing the effects of natural chemicals that narrow blood vessels. Alpha-beta blockers reduce nerve impulses to blood vessels. Additionally, alpha-beta blockers slow the heartbeat to reduce the amount of blood that must be pumped through the vessels. Central acting agents prevent the brain from signaling the nervous system to increase heart rate and narrow blood vessels. Vasodilators work directly on the muscles in the walls of the arteries, preventing the muscles from tightening and the arteries from narrowing. Blood pressure testing. The measurements of blood pressure are put into 4 general categories. Normal blood pressure. Blood pressure is considered normal at 1/128th of a millimeter of mercury. Pre-hypertension. Systolic pressure ranging from 120 to 139 mm of mercury or diastolic pressure ranging from 80 to 89 mm of mercury. Pre-hypertension tends to get worse over time. Stage 1 hypertension. Systolic pressure ranging from 140 to 159 mm of mercury or diastolic pressure ranging from 90 to 99 mm of mercury. Stage 2 hypertension. A systolic pressure of 160 mm of mercury or higher or diastolic pressure of 100 mm of mercury or higher. In a blood pressure reading, both numbers are important, although after the age of 50 the systolic pressure is even more important. Devices to measure blood pressure. Sphygmomanometer. Stethoscope. Sphygmomanometer. A medical device that is used to measure blood pressure that is made up of an inflatable cuff to restrict blood flow and a mercury, or mechanical, manometer to measure the pressure. A sphygmomanometer is always used in combination with the means to determine at what pressure blood flow is starting and at what pressure is unblocked. Manual sphygmomanometers are used in combination with a stethoscope. Sphygmomanometers consist of an inflatable cuff, a measuring unit, for example the mercury manometer or aneroid gauge, an inflation bulb, and a valve for manual instruments. The cuff is usually placed around the upper arm at roughly the same vertical height as the heart while the patient is in a seated position with the arm supported. Using the correct size of the cuff for the patient is important, as a cuff that is too small results in too high pressure and a cuff that is too large results in too low pressure. Once placed around the arm, the cuff is inflated until the artery is completely occluded. The pressure in the cuff is released while a stethoscope is used to listen to the brachial artery at the elbow. A pounding sound is heard as the pressure in the cuff falls when the blood flow first starts again. The pressure that this sound happened at is recorded as the systolic blood pressure. As the cuff is further released until the sound cannot be heard anymore, the number is recorded as the diastolic pressure. Stethoscope. An acoustic medical device used for auscultation or listening to internal sounds of the body. Often used in order to listen to the sounds of lung and heart. Also used to listen to the blood flow in arteries and veins. In combination with a sphygmomanometer, it is commonly used to measure blood pressure. Respiratory rate. The respiratory rate, breathing frequency, is the number of breaths a person takes within a specified time and is measured in breaths per minute. It is usually determined through counting the amount of times a person's chest rises or falls within 1 minute. There are factors that can cause the respiration rate to change, such as fever or other medical conditions. Respiration rate levels. Respiration rate levels for the average person are considered to be as follows. Up to 1 year of age, 30 to 40 breaths per minute. 1 to 3 years of age, 23 to 35 breaths per minute. 3 to 6 years of age, 20 to 30 breaths per minute. 6 to 12 years of age, 18 to 26 breaths per minute. 12 to 17 years of age, 12 to 20 breaths per minute. 18 years and over, 16 to 20 breaths per minute. Respiration rate depends much on different factors, including a person's age or the level of exercise, but can be used to determine if a person's respiration rate is normal, unusually fast, unusually slow, or non-existent. Tachypnea. Abnormally fast respiration rates are called tachypnea, where the respiration rate is too fast. When a person has a breathing rate of more than 20 breaths per minute, average adult, it is considered to be tachypnea. Causes for tachypnea can include heart or lung problems, panic attacks, anxiety, allergies, abnormal reactions to substances, asthma, exercise, or even labor during pregnancy. Bradypnea. Abnormally low respiration rates are called bradypnea, where the respiration rate is too slow. When a person has a breathing rate of less than 12 breaths per minute, average adult, it is considered to be bradypnea. Causes can include heart or lung problems, illegal drugs or certain medications. Non-existent. Also called apnea, is the period of time where breathing completely stops or is significantly reduced. There are two types of apnea, obstructive sleep apnea, and central sleep apnea. In both types though, apnea takes place while sleeping, and once occurring, the person might wake up or go from deep sleep into a lighter sleep. Respiration rate measurement. In order to measure the respiration rate, the patient should be in a resting position. To get the respiration rate, simply measure the amount of breaths the patient takes in 1 minute while breathing normally. For the average healthy adult, a normal rate is considered to be 16 to 20 breaths per minute. When measuring for respiration rate, it should always be considered that smaller children, newborn to 6 years, breathe much faster. Heart rate. The heart rate, also known as pulse, is the number of times that the heart beats per minute, and is usually recorded as BPM. A person's heart rate can change during an activity where the body needs to take in oxygen and discharge carbon dioxide, such as exercising or sleeping. A person's pulse can be felt at any place that will allow an artery to be compressed against a bone, such as the radial artery, wrist, the neck, carotid artery, the elbow inside, brachial artery, behind the knee, popliteal artery, as well as around the ankle joint, posterior tibial artery. By using a stethoscope, the pulse can also be measured by listening directly to the heartbeat. The pulse can be used to determine a person's overall level of health. In general, a lower pulse rate is better, although a condition called bradycardia, heart rate drops below 60 bpm, can be dangerous. Normal pulse rates are considered to be: newborn, 120 to 160 beats per minute. 1 month, 12 months, 80 to 140 beats per minute. 1 to 2 years of age, 80 to 130 beats per minute. 2 to 6 years of age, 75 to 120 beats per minute. 6 to 12 years of age, 75 to 110 beats per minute. 13 years and older, 60 to 100 beats per minute. Adult athletes, 40 to 60 beats per minute. Factors that affect heart rate. The heart rate can be affected by many factors such as medication, trauma, illness, temperature, exercise, stress, blood pressure, and emotional stress. Even breathing may cause slight changes in heart rate, although a person may not notice this change as it may not be significant enough. Breathing. Natural occurrence during respiration where heart rate changes slightly while breathing in and then returns to normal. Physical stress. Physical activity increases the heart rate as the heart has to beat faster and harder for more oxygen. If heart problems are present, this increased oxygen need might burn out the heart, causing the heart rate to slow down. Emotional stress. A person's natural response to psychological stress may increase heart rate. Fear and anxiety cause hormones to be released that make the heart work harder to provide muscles with sufficient energy, example, self-defense or escape. Medication. Over-the-counter medications, diet aids, prescriptions, herbal supplements, or even street drugs can cause changes in the heart rate. Stimulants, ephedrine, caffeine, or cocaine, may cause an increase in heart rate. Digitalis preparations and beta blockers can also slow down the heart rate. Vagal stimulation. This involves special sensors that will adjust to blood pressure changes. If a person is lifting something heavy or goes through labor during pregnancy, the higher blood pressure will signal the heart to slow down. Illness. Illnesses, such as a fever, will put increased metabolic demand on the body, and the heart rate increases due to oxygen requirements. If the body can no longer fight the infection, the circulatory system crashes and heart rate drops. Heart problems. Heart problems caused by plaque buildup in arteries, atherosclerosis, can lead to heart attack, failure of the heart, or irregular heart rhythms, arrhythmias. Arrhythmias may affect the heart rate, either increasing it or decreasing it. Abnormal heart rates. Tachycardia. Defined as a resting heart rate of more than 100 bpm, number varies as small children have faster heart rates. As the heart beats faster, it pumps less efficiently and less blood flow is provided to the body, including the heart. The increase in heart rate also causes more work and higher oxygen demand. Bradycardia. Defined as a resting heart rate of 60 or less bpm, symptoms usually don't occur until heart rate drops below 50 bpm. This condition can be caused when not enough oxygen is pumped to the heart, and can therefore result in cardiac arrest. Bradycardia can result in shortness of breath, fainting, or even death. Arrhythmia. Abnormality of the heart rate and rhythm. Arrhythmias can be separated into two categories: fast and slow rates. While some may cause few symptoms, others can cause severe symptoms of dizziness, feeling lightheaded, and/or fainting. Some arrhythmias can be life-threatening and result in cardiac arrest or even sudden death. Causes for abnormal heart rates. Abnormal or irregular heart rates can be caused by many factors, including but not limited to anxiety, stress, caffeine, nicotine, certain medications, overactive thyroid, exercise, hyperventilation, fever, diet pills, cocaine, low oxygen levels in the bloodstream, heart valve disease. Heart rate measurement. A person's heart rate is defined by the pulse of the body. The pulse rate can be measured in any place where arteries can be compressed against a bone to feel the pulsation. To feel the pulse, the index finger and middle finger are used. The thumb has a strong pulse that could interfere with the person's pulse and should therefore not be used for measurement. Points for measurement include ulnar artery, carotid artery, brachial artery, femoral artery, radial artery, popliteal artery, posterior tibial artery, abdominal aorta, facial artery, dorsalis pedis, superficial temporal artery. The apex of the heart, chest, can be felt with fingers or by listening with a stethoscope. With the use of an EKG, electrocardiograph, also called ECG, to measure heart problems or heart disease, a more precise measurement can be done. The measurement is done by placing detectors on a person's chest in order to record the electrical impulses on the heart. Once done, the test will produce a strip of paper, or picture, as the record of the electrical functioning of the heart. This record is called an electrocardiogram, also EKG or ECG. Common pulse sites include upper limb, brachial pulse, axillary pulse, ulnar pulse, radial pulse, lower limb, Popliteal pulse. Tibialis posterior pulse. Femoral pulse. Dorsalis pedis pulse. Head, neck. Facial pulse. Temporal pulse. Carotid pulse. Dorso. Apical pulse.